welcome to my channel Med Baba. This is my first video in my channel. I hope you will enjoy to learn and gather some knowledge from this session. Today we are talking about two conditions. Those are directly related to malnutrition. It's energy dependent. We can classify this protein energy malnutrition into two types, kwashiorkor and marasmus. First thing first, we have to understand that how we can differentiate to each other depending on what and how. We know our main dietary components are carbohydrate, fat and protein. We all know about the protein, that is the building structure and most important component of our musculoskeletal system, and there's also an important function of protein is to maintain the colloidal osmotic pressure in the blood vessels through albumin and globulin, mostly albumin. Here we can see the albumin is acting as the plasma colloidal osmotic pressure maintainer, and albumin comes from the liver. Now, when albumin is not sufficient in our body or in our blood, then the plasma colloidal osmotic pressure cannot be maintained up to the mark. So, through vascular endothelium, fluid leakage can be seen, and this fluid will accumulate in various sides of the body like face, abdomen, limbs, etc. And this condition is termed as edema, accumulation of the fluid in the body cavities. So we can see here, this is Mr. Tom, and his face is resembling the moon-like face. So we can see the moon face here, and due to edema or accumulation of the fluid in the abdomen is enlarged, and we all know about that albumin comes from the albumin. It's a synthetic function of that liver. So due to lack of albumin, fatty liver can be seen, as in absence of protein, excessive accumulation of triglyceride leads to fatty liver, and the liver become enlarged. So we can see enlarged abdomen in this baby, Mr. Tom, moon-like face and edema. And associated features we can see here from this chart, that as he only lacks of protein, so others component like carbohydrate, fat is sufficient enough for him. So he will develop mild growth retardation and mild reduction in body weight. And as we already learned from our previous discussion, that there is abdomen enlarged due to enlarged fatty liver, edema, moon faces is present here, and related to that we can see some flaky paint like skin, and he will be lethargic, and to correct this condition he requires adequate amount of protein. Now here there is another condition like marasmus. In this situation the all component including carbohydrate, fat and protein is not sufficient or up to the mark. So this boy will develop uh, calorie deficiency. So overall he will develop severe growth retardation, severe reduction in the body weight. And compared to that, kwashiorkor baby, Mr. Tom, Mr. Carey will develop shrunken abdomen and subcutaneous fat not preserved. And here there is no edema, no fatty liver, and there is no hair changes noted. Whether there is some changes in the kwashiorkor sparse hair, and here is no hair change. But in this condition, Mr. Carey is alert but irritable, and he requires adequate amount of protein, fat, and carbohydrate, all the components. So that's all.